gold standard in research is represented by randomized controlled trial. While RCT ensures the safety of patients selected by the clinical trial center, there remains the need for clinicians to how patients will respond to a chronic therapy in real life and potentially influencing factors such as patient digital skills and medication adherence. Decentralized clinical trials are conducted remotely, enabling participation of a more heterogeneous population who can participate in research activities from different locations and at their convenience. Pragmatic trials are designed to find out about how effective treatment actually is a routine everyday practice. Remote decentralized clinical trials are proposed as one way to improve clinical trials, employing digital and other innovation to move clinical trial activities to a participant home or local setting may reduce or eliminate physical visits to a clinical center. This change should make trial more accessible and participant-centered and produce results more applicable to the wider population and easier to translate into usual practice. And to evaluate whether the narrative interview can be used to improve medication adherence. Personal stories are readily collected and can provide a window to the healthcare system within which people's illness experiences are embedded. In narrative interview, the researcher invites participants to tell me what happened and allow them to speak uninterrupted until the story ends. The key structuring devices are chronology, linking events in time, and employment, use of metaphor, imagery, and rhetorical devices to imply causality and agency. The challenge of narrative research is not to control for the inherent subjectivity, inconsistency, and emotionality of story, but to capture these phenomena as data and interpret them appropriately. The analysis of the narrative interview for this is therefore there are 3 steps which, as a good film editing, reflect 3 progressively more generalized moments of analysis: transcription, content analysis, meaning analysis. In order to analyze the content, and to identify the units of meaning which we have chosen MV software. 10 patients has been so far recruited by us to 4. Recruitment and data collection are ongoing and results are expected in the next month, addressing the impact of the therapeutic prescription in the patient's life. 10 narrative interview and questionnaire has been administered in order to identify the educational needs of patients. The analysis units has been classified according to the Bloom education issue and the Epoch taxonomy kinds of activities. Polytherapy, comorbidity, and self-management are 3 factors that must be taken into consideration by educators when they plan therapeutic education. In fact, it's urgent to create education pathways for self-management of therapy in patients who live alone. The revised Bloom's taxonomy provides an even more powerful tool to fit today's educator needs. The structure of the revised taxonomy table matrix provides a clear, concise visual representation of the lineage between standards, educational goal, objective, product, activities. Bloom taxonomy differentiates between cognitive skill levels and call attention to learning objectives that require higher level of cognitive skills and therefore lead to deeper learning and transfer of knowledge and skills to a greater variety of tasks and contexts. Today, health professions educators wish to develop learning skills at the higher levels of Bloom taxonomy that require demonstration and deeper cognitive processes such as critical thinking and evaluate judgment. But studies have shown that learning objective in many training programs and curricula focus overwhelmingly on the lower levels of taxonomy knowledge and comprehension. This shortcoming must be considered by educators if health professionals are to achieve increasing level of skills and function. Digital skills, daily habits, and education profiles of patients represent the main categories according to the EPOC taxonomy of patient-oriented action and in particular their own safety. Bloom's taxonomy allowed to identify educational objectives, increasingly empowering patients. Thank you very much, and my contact is sabrina.grigolo@unito.it, University of Turin, Italy.